Hey everyone. So here we are again. Welcome back to another episode of BioNexus Health, Autism Uprooted. Today we'll be speaking with Larissa. Larissa is from New York City. She is a cardiology specialist nurse practitioner. Her son and daughter have had remarkable progress on the herbal medicine protocol. And Larissa is here to shed some additional light on how she achieved what she has achieved with her children today. Let's welcome Larissa to today's show.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Dashore.
Hi, Larissa.
Hi, Dr. Dashore.
So welcome to today's podcast. Thank you for being here.
Thank you for inviting me.
So right off the bat, let's get started. What brought you to BioNexus Health and herbal treatment? You are a cardiology specialist, nurse practitioner. And I'm just, curious, what brought you to herbal medicine?
Well, about a couple of years ago, we lived in a house that I suspected had mold after Sandy hurricane, because it was flooded, but I never paid attention and I couldn't connect the dots together when I developed autoimmune disease myself. My daughter and my son were born both in that house, and they had been struggling with multiple gastrointestinal problems since basically birth, and nobody knew what was going on. All of the labs were messed up. Like my little one had elevated calcium all the time, and we've been to hundreds of practitioners and nobody could pinpoint the simple fact that we were living in a moldy house, because they're not aware of it. Eventually, we were looking for a practitioner who can help us, and we found you. I basically Googled myself, and that's how I got introduced to Dr. Shoemaker's works.
Yes.
And then he recommended practitioners, and I just chose based on my zip code. You were the closest one to us.
Oh, okay. So you have both your son and your daughter have been on the natural protocol. So you were actually okay with an all-natural approach.
Yes, I myself, I cannot tell. I'm very sensitive to chemicals, like all of the chronic patients who've been like SIRS and mold and Lyme. And I didn't even know that I had Lyme at that time when I met you. And when you told me about it, I was shocked. That was my initial response. I could not believe that I passed along my Lyme to my children. Never knew about it, that it could happen that way. So that's why antibiotics was out of the question, because I hated antibiotics. I've been taking multiple antibiotics through my life, and I know that always side effects that follow antibiotics. So microbiome is wrecked. You need to replenish the good bacteria, which some people can do it year after year, but it never is replenished, because that's tremendous toll that antibiotics, take place on humans' body. That what happened to me in the past. I didn't want my children to go over it. And I decided to go natural at this point, because I've heard about herbs, I've heard about homeopathy, but I never tried it. So I gave it a shot with you.
Awesome. Yeah, I'm glad. Superstorm or Hurricane Sandy did quite a number on New York City. So I'm not surprised that your house was affected as well. Many people, even after being flooded, were not aware that the floods need to be cleaned up. I mean, it wasn't really possible to clean everything up within 24 hours, because I think for a whole week, many people had no power. There was no electric for a long time.
Yes, at that point, we just moved into the house. We were very lucky to buy the house and get flooded in 1 month.
Oh, goodness. Okay.
Yeah, so in the end of September we moved in, and the end of October we were flooded.
Yes.
And we were still trying to, bring the new furniture in the house, but we have to get rid of it immediately. So it was 6 feet of water, and we had to leave a couple of days with our friends. But then when the water went down and we went back to the house, my husband, the first thing what he did, because he is doing construction, he ripped off the walls, and our first floor, basically, he was trying to dry what is left.
I see.
He replaced as much as he could. I thought that we were safe because he did such a great job. A lot of people were living in the moldy houses for a long time, but we were not. But since we had a semi-attached house, our neighbors didn't do anything.
Oh, that's right. Okay. Yes.
Right.
Yes. Okay.
So we did our job, we did our part, but instead of doing their part, they just sold the house in a year. And when the new owners came, years down the road now, when I communicate with them, I can recognize the impact of mold in their lives, because when they moved in, everybody was healthy. Now 6 of them in that household have problems, but nobody wants
look
to
at
admit that
right.
this is mold.
Right.
Yes, and they don't believe me. It's a choice. Like with everybody, it's a choice. Some people, like you said, prefer antibiotics. Some people prefer natural. So I made my choice because I was looking for the answers since we got flooded. And it was 8 years to be exact. So
Yes.
8 years suffering, and I just decided to put an end to it. And we sold the house, and we moved out 3 years ago, and everybody started to clear off the mold toxins finally.
Finally, yes. Some people, like you mentioned with your neighbors, I guess some people just prefer to keep their heads in the sand. I don't want to know anything.
Right.
I'm just managing. Yeah. We got 1 foot of water in our basement. And I remember, we lost a lot of paperwork. No, I think it was more than a foot. We got 2 to 3 feet, actually, now that yes, the roof blew away, the shed blew away, and we got a few feet of water. I lost important documents which were stored in the basement, my certificates, my transcripts, and family photographs, a lot of stuff, wedding certificates and all of that, college graduation. But anyways, yeah, we had to rip everything out as well, just so that, and as you know, right, papers and anything porous cannot be kept after there has been water damage. So otherwise it affects the health. Yeah. So we started treating your daughter and your son, and you mentioned that, I was able to recognize underlying concerns with you as well, and we have been treating you. Yes, I was as shocked as you were when way back in the past, I discovered that I had tick-borne infections and that Lyme disease, and I had passed it on to my son. Probably even the mold toxins were, passed to him during pregnancy. And yeah, so both your son and daughter have been on the protocol, and they have just done remarkably well. You've both have been very compliant. You've made sure that everything is done the way it is supposed to be done. And one thing that I love that you said to me one day, that I don't remember if it was about your son or your daughter, but it's like, it's a whole different person health-wise. So can you explain a little bit that what progress have you seen first with your son and then with your daughter?
Yes, I believe I spoke about my son because at that time when I was looking for a practitioner like yourself, so I was desperate. My at that time 3-year-old son, he was always had mood problems with his mood. He was on the depressive side. He was crying. Something was bothering him. He wasn't gaining weight. I mean, he's still skinny, but his mood has improved dramatically. So because I could not tolerate when he was crying every 5 minutes. Oh, mommy, I don't want to do that, and this is bothers him. And he was not diagnosed with autism because he was talking, but his pediatrician couldn't understand why he's not so happy all the time. And once we started the drops, the minerals, the protocol, immediately within like 2-week period, me and my husband, we noticed that he became a happy kid. He wasn't crying anymore. He was happy, actually, playing with his sister, with other, kids. And in a year, he was able to join pre-K. So because I was afraid that he would never go to pre-K because everything was disturbing, everything was bothering him. He was very sound sensitive. He was very tired all the time. He wanted to take naps and he didn't want to take naps. He didn't know what he wanted. But I remember you said, not everything is lost, because he was asking for forgiveness. Remember I told you that? He said, Mommy, I'm sorry. I don't know what's happening, but I'm sorry. And when he was asking for forgiveness, because he needed help at that point, I was going above and beyond just to help him, because I felt so bad for that little kid whose fault it wasn't that he was born in a moldy house from the mom who had a mycotoxin illness on top of it. So that's the story. With my daughter, it was a little bit different. She had some mood issues, but primarily she was a compliant child. Basically, she was already in school at that time. We moved out, but the protocol helped her dramatically in a way that she started to grow. She started to gain weight. She started to improve in school, more concentration. I noticed that for the past year and a half, she gained 25 pounds.
Oh, God bless. Wow.
And she became like very tall, and she joined gymnastics. So she became stronger. So she's a big sister now. I'm very happy about it. She stopped screeching her teeth at night, which is, might be a sign of parasitic infection or any underlying infection, whatever she had. And she also started to fall asleep immediately after she gets to bed, like without any problem. Before, it was 12 o'clock, they were still jumping. They didn't want to sleep. They were like overexcited. And then it was like a bad habit of them going to bed all the time at late. Now, every time when they hit the pillow, they sleep. They became more calm. So it means that the body rests and they can, function normally in the morning.
How about their gut? Both of them had a pretty severe lab work, right? That came back, lots of problems. So how have you seen their gut improve?
Victoria, when she was born in that house, she always had constipation. Until she was 2 years old, I was giving her enemas. Maybe she had like a few bowel movements on her own. I went to different specialists and GI doctors, and nobody could figure it out. It was like either parasitic infection or a long-standing bacterial infection, that dysbiosis, that was happening. They were giving them Miralax, like all those medications that were helping temporarily, but then the problem came back. So I was tired of all of those medications. I stopped them. And when we switched to herbs, Victoria since then has bowel movement every single day. I'm not going to say. She's like, did you go to the bathroom? Yes, Mommy, I was twice.
Oh, great.
So yes,
great.
Christian never had constipation problem, but he was on diarrhea side. So he had multiple loose bowel movement. And now and what really concerned me in that house, in that moldy house, that he was peeing frequently. I changed like 50 diapers a day. We did not know that the urine was very diluted. It was like water. He was dehydrated. So once we moved out from the mold environment, literally he started peeing like 2, 3, 4 times a day max. And the urine became concentrated. That was a miracle. Nobody could answer us why he was, urinating that frequently. But then after reading your book, I realized, like, I connected all the dots. Like, I also had the same problem. Once I was in the house, I had frequent urination at the end of living in that house. I couldn't control myself. I was just, urinating frequently. And once we moved out, it normalized. So that was the...
So his gut has normalized as well now?
Christian is better, but
Okay.
I think more work should be done.
Yes.
With Victoria, I'm positive that she tolerates most of the foods. She has variety of foods, vegetables, fruit, even gluten I started to introduce, but not American gluten. We buy gluten, we buy flour from imported from Russia or Poland. So I think it has less gluten content in it. She can tolerate it. We don't give it every day, 3 times a day, like most of the Americans do with a standard American diet. We give it like once in 3 days, bake with that type of flour, because gluten-free flours I found also offensive. Some of them. You have to know a very good brand.
The good brand, right?
Yeah.
That's right.
Yeah, which is sometimes hard, and we have shortages of that nowadays.
Mm-hmm.
So it's hard to get, and it's very expensive nowadays.
Yes, isn't everything? I know. It's very economical and cheap and easy to fall sick.
Yes.
Right, to ruin your gut, to ruin your health, to shut down your immune system. But it is very expensive and hard to crawl your way back to health. That's what that is. And with Brian as well, we had a frequency of urination every 20 minutes.
Yeah.
It just, and he was, yes, it was very dilute, but he was passing urine. It's not like 1 or 2 drops. I thought maybe it's a UTI, but he was actually passing a significant amount, like normal amount of urine every 20 minutes. And for us, it actually took, for treating Lyme and Bartonella as well, other than his mycotoxin exposure. So all 3 was required for him to stop his frequency of urination. Today, I was speaking with another, a dad, an autism dad, actually, of an older kid. Now, apparently was doing well. He did really well on the BioNexus protocol. So we ended up discharging the child at the age of 14. Now the child is 17 and has come back. Everything is fine, still has lost the diagnosis, but all of a sudden has started enuresis, which is bedwetting again. So at the age of 17.
Wow.
So that's when we kind of figured out that the school seems to be a problem with the mold. The house has been remediated and whatnot. The school recently, they had lots of rain. You must have heard, right, around the country, right? The Pacific Northwest and Midwest had a lot of cold and rain and snowstorms and flooding and what have you. So that affected the school building, and Zachary just reacted, reacted right away. And at the age of 17, he's lost the diagnosis, he's mainstreamed, he's got good language, and now he's embarrassed because he's bedwetting and he's scared that he's gonna, so we just started him back on treatment, and we'll see how it goes. But so that is good. Overall, you and your children are doing really well, and it's a completely natural protocol. And I remember you being stressed when I first met you, and then looking at you, relaxed, smiles. In fact, you mentioned to me, Larissa, that you went on vacation domestically as well as traveled abroad, and both the kids did really well.
Yes, I mean, we brought a couple of bags, then we checked the stool. Remember, you said is the result of your traveling. It's because they were exposed to swimming pools, like the environment in the hotel. But we tried our best. We tried to find a very good hotel, like reputable. But you never know.
Yeah.
Like you never know how is it. They might tell you a totally different story, and you don't know exactly. But people leave reviews, and actually we're very happy with that place. So we're looking to come back next year.
Oh, same place that you mentioned
Yeah.
to me as well, right? Yes, obviously we won't take names, but I looked it up, and it's very interesting that they don't have wall-to-wall carpet. They have those little area rugs. There's no carpet, which is great. Most hotels have wall-to-wall carpeting, so that can be quite problematic. But
Right.
it's important to choose wisely when you choose a hotel. So good. At least if you can open the windows or open the doors, that is very helpful. I remember going for a conference to the UK one time. And interestingly enough, since most of the buildings are pretty old, the windows could still be opened. And I was up on the 7th floor, and it was clearly moldy.
Yeah.
And I had my air purifier with me, 2 of them actually. I always take one for the room and one for the bathroom. So I had those 2 going on, but I would leave the windows open the whole time I was downstairs at the conference. So there was, fresh air coming in, and that makes a big difference if the room is moldy. So another tip for choosing a hotel is that you should be able to. Recently, Brian presented at a scientific conference in Boston. And the hotel that his professor chose was a regular hotel, but luckily his room, he said that he was able to open the windows, and that was, and this is great that he understands what needs to be done, when he's spending even just one night at a hotel. So it's important to, as our kids recover, as they get their brains back, their bodies back, it's important to kind of educate them, just like you do, I know, about diet, about, environmental safety. So because they already have the genetics, you can't do anything about genetics.
Yes.
They just have to be cautious. Okay. So any final words you would like to add for any parents out there, who have children who are suffering from mold exposure, who are considering to skip the harsh conventional medicines like you mentioned, and to go for the completely plant-based herbal protocol? What would you say?
Well, as a mom, I think it's very difficult for most of the moms to recognize the problem, because we, as parents, we bring them to pediatricians, to conventional therapists who recommend, and some of us value their opinion because they're professionals. And the most important thing, I think, is to recognize the problem and to search independently. Don't rely on the practitioners, because that's what always was triggering me. Like the triggers, there were multiple triggers, but I was like, it doesn't sound right. I know that what she said, but I don't agree with that. Let me Google. And Dr. Google, other, like, the information that I found, luckily, thank God, was very reputable and from good sources. So I was able to filter what is wrong and what is right, and weigh it and make choices. Find a good practitioner like you, Dr. Dashore. And also, the most important thing for the parent is to give 100%. So basically, the first step is to start, and then just do it. Do it every day. Sometimes, you're late for school, for work, and you just want to do those drops. And if you skip it that day, give it in the evening or before they go to bed, but just do it. Don't forget that you have that valuable material, valuable herbs and supplements that make them feel and yourself feel better. So just do it consistently, day in, day after, so because it works. We've been on it like over a year. And as myself, I can say sometimes if I skip, I know already that I shouldn't have done that. When we travel, for example, we don't take stuff with us because it's a lot of things. And recently they opened them, they opened our luggage and look through the luggage and open our herbs. I didn't like that. They spilled the herbs. So the fact that they do that is just, it's not right, but they were looking for something, I guess. So, but if you can take it on a trip, so try to minimize the exposure of the environment and like try for organic foods. Like again, make choices. To make choice is really hard sometimes because I spoke to many moms who have kids and they have autism. And when I give them recommendations, just because I know them and they're my friends, they agree. But then they tell me, oh, Larissa, it's so hard. I don't know how you do that. Ugh, it's so easy just to go and buy those Lunchables for children and give it to them because it takes
ew. I'm
just,
sorry. Wow.
Yeah, Lunchables.
Lunchables.
That's what my daughter says. Most of the kids in her class have Lunchables. And
oh my
she
God.
never tried that. And we always try to send her home with homemade foods and tell them, do not expose them to this and that. And of course, it's hard when they buy pizza for the whole class and the child is left out and everybody thinks that the child is different, and kids don't want to be different. They want to have friends. They want to be in the same environment. But you can provide with a gluten-free pizza slice or something. Just arrange for a gluten-free muffin, give it to the teacher and tell them to give it to the kid. So it's a hard work, but it's rewarded at the end, if you're consistent. So that's my advice.
That is very well said. People that come to me are actually well researched like yourself, and they don't want to do anything invasive with their children. And they say that, we want to keep it plant-based, we want to keep it all natural, and we are willing to do what it takes. The important thing to realize is that, these underlying issues are not just mild medical issues, right? We find some major cardiovascular risk factors. We find clotting factors. We find major infections that affect multiple organ systems. And, all living organisms, including microbial organisms like bacteria, viruses, they grow. They all have a reproductive cycle. So if we sweep it under the rug right now for our children, right? I'm not interested in doing labs. I don't want to investigate. He's diagnosed autistic. Fine. Here's Lunchables. It's easy. I'm doing my best. I have other kids. Okay, fair enough. I understand. Busy mom. You have to pay the mortgage. You have to work. Got to pay the bills. But understand that you have to be ready to face the possibility, depending on various factors, then what's going to happen in the future, right? All of these neurodegenerative conditions, autoimmune conditions, cancerous conditions have been associated with chronic inflammation in the body. That's there's so much research out there that shows this. So I always remind my son, he's in med school now himself, and I'm glad that he's had this foundation, not that he's been through so much suffering, but the learning aspect of it, that he understands chronic inflammation. He understands that going out with friends is great, but it is perfectly cool to say no thank you, but you go ahead.
Yes.
You proceed. Someone's having a drink, great, it's not for me, but please proceed. It's not uncool to say that. It is very cool to stand up for yourself, to establish your preferences. And nowadays most people have allergies. I know Brian tells me that in his friend circle, one is vegan, One cannot have alcohol, due to religious reasons. Another one has allergies to this and that, so they're always ordering their own stuff. It's not like he has to keep snacks in stock because friends know. They know that he's got his own thing.
Right.
And they all have their own things, and everyone respects each other's preferences. And the last thing I'll say about this is that, when our kids, Larissa, when they are 50, and if we are fortunate enough to be there, when they turn 50, you will see, and they will see that compared to their peers, the health is fantastic.
Mm-hmm.
I have so many patients that have gone through the Herbal protocol, and I myself still do it, once, sometimes twice a day, every single day, because it makes me feel good. I'm not doing like 500 herbs. I'm doing maybe 5 or 7 herbs, and it's what keeps me even. And I recently had to switch dentists, like temporarily.
Mm-hmm.
And this the nurse is looking at the paperwork I filled, and she's like, "You haven't filled your medications." And I'm, and she's looking at me, looked at my age, and she goes like, "Yeah, you didn't fill. I don't have any." She's looking at me like suspiciously. Yeah, right. Like, I don't take any prescription meds,
Right.
And unfortunately, in my age group, it's quite common to have like 5-7 prescription medication for all different kinds of things, diabetes and blood pressure and whatever. It's just, and I've had some of my clients go through the same thing. People look at them suspiciously, like, "What? No prescription meds?" No, we don't have any. Like, knock wood.
Mm-hmm.
So that's what's going to be the good news with our kids as well as they get older.
I hope so.
Very good. All right. So awesome. Thank you so much for joining me today. I really appreciate you being here.
I'm very happy to be there.
All right. So that brings us to an end of today's podcast. Thank you for joining me, everyone. And I will see you back here at the next episode. So until then, be well. Namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.